Hi, welcome to your checkup. We are the patient education podcast, where we bring conversations from the doctor's office to your ears. On this podcast, we try to bring medicine closer to its patients. I'm Ed Dulesky, a family medicine resident in the Philadelphia area.
And I'm Nicola Rufo. I'm a nurse.
And we are so excited you were able to join us here again today. So you have been working really consistently for a really long time. Like, you picked your head up and
one of us has to go to work.
All right, don't blow me up like that. Coming week I am. And
for the first
last
time
2.5 years.
In 2025.
The last 2.5 years, I have. You know, 24s, nights, what have you.
I know.
Yeah. But you finally accomplished something really great.
I accomplished something really great?
You acquired a day off.
Oh. I mean, it's not really an accomplishment.
I think it is.
My boss practically told me to take off.
Yeah.
So I was like, thanks, sis. Twist my arm.
She's great. And a day, so like, there happened to be days when
it's the first weekend in April. And did I tell you this when I was setting my out of office? Mm-hmm. From the previous one I last had was in January.
Yeah, it's a little long.
Yeah.
That's a little long. There's so we had this Friday, but we had it together. And there's like sometimes where I'm doing like work remotely at home and like learning at home on a Friday or something recently. And it does not feel like a day off by any means. But you were home yesterday. We woke up Thursday, felt like Friday. Mm-hmm. Very sincerely, Friday all day felt like Saturday. And then going to bed, weirdly, it felt like Sunday.
Yeah, it did. I think it's because we made fat rigatoni and cookies for dinner, and that's usually like a special Sunday thing. You
know what? Maybe that is why. And in this fat rigatoni, we did shrimp. Mm-hmm. That dish, I'm like a dog. My focus is like only on what's in front of me. And now I'm not even sure like the episode where we talked about like the three, like your triumvirate of food has come out yet. But like, I just can't, like, it was the burger bowls, and now I just can't get off of fat rigatoni. And I know there's more in the fridge and I can have it, and that's great. But like your food is just so amazing.
Well, thank you.
I can't get over it. And we might get sandwiches tonight.
Yeah. A hoagie with a salt and vinegar chip is honestly top tier.
Yeah. And I kind of, before, I definitely wasn't someone who was putting chips on a sandwich.
I can't believe you never did that before.
I mean, believe it.
Chips on a sandwich, like on a hoagie on the beach specifically.
Yeah.
Plus or minus a Corona.
Or 12.
Or 12. There's nothing better.
Well.
Especially, okay, perfect scenario. We get a hoagie at the beach from our favorite place. Salt and vinegar chips. We're on the beach. It's late in the day. We've been on the beach all day long. We're kind of tired from doing nothing all day. We get a sandwich. We have it. You put the salt and vinegar chip in the hoagie. And then it's getting a little, not dark, because I guess the sun sets at like 9 o'clock in the summer. But it's like almost dinner time. It's a little cool. Then you have to put a sweatshirt on. And you have a sweatshirt and your bathing suit. It's the end of the day. Sun's going down. The lifeguards are coming in. And you're eating your sandwich with your salt and vinegar chips on the beach. And it's crunchy. There might like be a little sand there somehow. But for some reason, it's really good.
I guess, which sandwich from our favorite place are you putting it?
Well, I mean, really on any of them, but I love that turkey one with the pepper shooters on top.
I could see it going on.
The one
there.
We got last time.
Sure.
Yeah.
I feel like we haven't done that a whole lot, though, with the chips.
I have. I don't know what you've been doing.
That's fair. I mean, you're not going to put it on a buffalo chicken version of that.
I mean, it actually might be good. Salt and vinegar on buffalo chicken.
Who knows? Maybe that would happen. Maybe that would be something to try. This picture that you painted needs to come now.
Yeah. We can try on like Memorial Day weekend and we'll report back. Because it'll still be like kind of a little chilly because it'll be May, you know?
Yeah. Oh, gosh. I can't wait for that. In other news, I'm falling apart. I mean, it was like last week at this point where I was like outside doing a run and then just walking. And I was listening to the feature special where LeBron was on the Pat McAfee show. And I just like randomly hyperextend my knee while walking up a curb very nonchalantly. Some guy like double took and saw like what I did. And I was like, that's weird. So then I kept walking like nothing happened. But I was like a little nervous because I have that whole like work in medicine anxiety about health.
Oh.
I know, poor baby. And then like 3 days later, my calf hurts, which I'm so much more grateful that this is probably just a calf strain and nothing like interior on the knee there. But then I'm like going back to the gym and I'm doing legs again. And I decide like it's time to be athletic. And then boom, all of a sudden, low back pain. And like, this is probably my karma for like, I don't know. I thought I was very sympathetic for my most recent back pain patient, but maybe I didn't listen as well, or like it could have done a little better on the margins. I don't know. But now I'm living it and this is my karma. So now I have like low back pain.
Well, you really don't like stretch or work on any kind of like mobility ever.
No.
Which doesn't help you.
No, I don't. I do feel like sometimes this is probably catching up to me. I'm like at this point in my life, I'm someone who's like squeezing workouts in, and I don't know, like if I peel myself out at 5:50 and then I'm able to like make it into the room by like 6, maybe I should stretch more. I'm making excuses. This is ridiculous. I should just stretch more. Yeah.
It'll help.
It probably will help. That foam roller experience was something.
I can't believe you have never done that. And like you were an athlete growing up.
I certainly was. No, never really foam rolled. I mean, maybe that's why I had so many soft tissue injuries. Who knows? Perhaps.
Probably.
Mayhaps.
I'm
saying mayhaps more. All right. What do you think?
What?
Should we dive in?
Sure.
Okay. So the next section we're going to talk about here is managing allergic rhinitis, but using medications and some other treatments as well. So if you will, join us on this next part of our journey here. So the most common first line treatment is a nasal corticosteroid spray.
Listen, I need to say one thing.
Go ahead.
Before we start talking about all these magic medicines.
Yeah.
None of them are going to fully make you feel better. No cocktail of anything is going to completely change your life. It'll just take the edge off a little bit.
Okay.
Which is better than nothing.
So you're like almost implying just like managing symptoms instead of
you
like
can
straight
like
up cure.
Maybe, yeah. You're not going to feel all better. It's going to be like a 2, if you're a pollen allergy girly like myself, it's going to be like a 2 sucky months out of the year. You can take your medicine. You'll feel like a little bit, you'll be like a mildly less miserable.
Well, I guess, do you consider that maybe like you may have a more moderate to severe flavor of this?
Oh yeah.
So then maybe there is some benefit that could be had for people with like mild-ish to moderate.
Well, yeah, maybe. I'm just saying like.
To like set expectations.
Yeah.
That
like you're not going to like pop a Zyrtec and like.
Boom.
Be fine.
All better.
Yeah.
And go roll in some pollen.
Mm-hmm.
Okay. No, I was awesome. So we're going to go through each class of medications and try to be a little more detailed. So there are nasal corticosteroid sprays or nasal steroids. Essentially how they work is that the steroid helps reduce the inflammation in the nasal passages that are causing all of the symptoms. And that's the main cause of the allergic rhinitis. And so the idea is to get at the core of the issue and try to help manage it. The effectiveness is generally that these are considered the first line treatment, and in a few studies are considered more effective than the oral antihistamines for relieving most symptoms of allergic rhinitis. And so they can relieve a runny nose, congestion, itching, and sneezing. There's some examples of over-the-counter medications by the brand called Flonase Sensimist, Flonase Allergy Relief, Rhinocort Allergy, and there are some prescription options available as well. One of the most recent things I've been counseling people on more sincerely is how to use the nasal medicines better. So the idea is to properly use this with good form. And what you're going to do is you're going to hold your head straight with your chin slightly tucked. You are going to take off the cap and make sure, maybe send a primer or two of the squeeze. You're going to put the medication in your nose, the applicator, and you're going to point the applicator away from the middle, so towards the outside of your nostril. And you're going to squeeze and deliver the medicine, and you're going to sniff gently, like you're sniffing a flower. If you snort it, you're going to taste the medicine, and it's going to shoot all the way back into your throat, maybe into your lungs, and you're going to taste it. And that's when you know you've done too much. But if you inhale and waft like you're smelling a flower, you're going to deliver the medication right into where it needs to go, up in your sinuses, towards the top of your nasal passages. Sometimes people will hold one nostril closed while spraying the other. And it's a decent suggestion to spit out any extra medication that goes into your throat because it's not going to do anything in there. Sometimes people have some luck using a saline nasal spray before they apply their Flonase, or their fluticasone, if you will, to clean it before they use the medication. Nikki, when do people usually feel like they can expect relief?
It varies. Some people say that they have relief with the first day, but it can take days to weeks to actually experience any relief. So good luck.
Yeah. It is important to regularly use this medication. It's described that they're best used when you do them daily, and especially when you have recurring or persistent symptoms. And once your symptoms have gotten better, you might be able to reduce the dose. And so, like, with the first thing that people usually say when they are talking about using a medicine is, unfortunately, like, I don't care what this medicine does for me, but what is the side effect? So the side effects are a slightly unpleasant smell or taste. Sometimes there is drying of the nasal lining. There can be irritation, crusting, and bleeding of the nasal septum, especially in the winter. And that can be minimized by reducing the dose and perhaps using a moisturizing nasal gel or spray ahead of time, or switching to a water-based spray. Is there, in terms of long-term use, is it okay? Is it something to think about? What are we thinking about long-term use?
Long-term use of these medications are generally safe to use and really not associated with any side effects. For children, however, if your child is taking it for more than 2 months out of the year, it may slightly slow your growth rate. So something to think about.
Yeah.
Talk to your doctor about.
And specifically, these are very different than steroids taken orally, and they have far fewer side effects than those medications may imply. And for pregnancy, certain sprays like cromolyn, which we're going to mention later, fluticasone, budesonide, and mometasone are generally considered safe, but please don't take our word for it. Ask your own doctor who's taking care of you. So that was the nasal steroid spray. There's another class of medication that can be very helpful, and they're called antihistamines. You mentioned earlier in the episode that histamine release can be at the core of the reason that people are experiencing these symptoms. So antihistamines work by relieving itching, sneezing, and the runny nose by blocking the effects of histamine, the chemical that's released during the allergic reaction. But notably, they do not relieve the nasal congestion. And so there are oral antihistamines that are taken by mouth, of course. There are non-sedating ones, which tend to be causing less drowsiness, and examples of this include loratadine or Claritin, desloratadine or Clarinex, cetirizine, Zyrtec, levocetirizine called Zysol, fexofenadine or Allegra, and most of these, like loratadine, cetirizine, fexofenadine, are available over the counter. There are ones that are more sedating, and they should be used more with caution. And this is like Benadryl or diphenhydramine or chlorpheniramine or brand name chlortrimetron. Generally, newer non-sedating medications are preferred because they don't make you fall asleep. The side effects are more so associated with the older brand, and for use in pregnancy, most of the time, cetirizine, loratadine are helpful and safe. And then use in children, they do come in some liquid forms, and so many non-sedating antihistamines are also available for that reason. But antihistamines are not limited to oral medications. There are nasal antihistamines, which some people find very helpful. They work by relieving symptoms of postnasal drip, congestion, and sneezing right at the source, and they can start working within minutes. Examples of this are azelastine or Astelin or Astapro and olopatadine, which is like a brand name Patinase. That technique that we talked about, that technique that we talked about before, you should use for this. You keep your head tilted forward and you do all of those things we mentioned before. The side effect really is just a bad taste in the mouth. So all of those can be very helpful. And sometimes what they do is they combine them together. They take a corticosteroid and an antihistamine spray. And so it combines the benefits of both the steroid and the antihistamine. And there's some evidence out there that both together may work better than either drug alone, which isn't rocket science, but I think you have to actually do the research to be able to do that. The brand name of this medication is called Dymista, where it combines fluticasone and azelastine. A combination of multiple over-the-counter agents is probably going to give you the same benefit. Once again, the side effects of this might be bad taste, nosebleed, and possibly a headache, and it's approved for use for people in age 12 and over. So another class of medications are decongestants. How they work is they help to relieve the nasal congestion by narrowing blood vessels in the nasal passages. And this is, while they're very effective, they're often combined with over-the-counter allergy medicines, and they include common medications like pseudoephedrine or phenylephrine. And a gigantic word of caution is that, frankly, we discourage people from using oral decongestants because there is a potential side effect of increased blood pressure and increased heart rate. They really aren't appropriate for people with high blood pressure and certain cardiovascular conditions. And that's what we have to say about that. They are not really safe for people who are pregnant and especially in the first trimester. Nasal decongestion sprays, like medicines like oxymetolazone or Afrin, are also out there, or other brands of phenylephrine. And really, these are not recommended for allergic rhinitis because, well, frankly, they can't be used for more than 2 or 3 days in a row at a time because they can cause something or rebound congestion or rhinitis medicamentosa, which is difficult to treat and is consistent, persistent rhinitis when the medicine isn't present. And that is very challenging. And so it's best to avoid that altogether by avoiding these medicines if you can. One of the last ones we're going to talk about is a cromolyn nasal spray. What this does is it prevents the symptoms of allergic rhinitis by interfering with the ability of allergy cells to release the inflammatory chemicals. Really, these aren't as effective as other treatments, but sometimes they can be used before symptoms begin if you know you're heading to an area. It's just another option in the toolbox. It happens to be really safe for people who are pregnant and also possible for children as well. It really has to be used several times per day to be effective. Can you tell us a little bit more about nasal irrigation and saline sprays?
It's exactly what it sounds like. You're just rinsing the nose with a saltwater solution. And the idea is that it washes away the allergens from the nasal lining to remove the allergen.
Those were all of the most common treatment options. And there are a lot of options available. But something to note is that and we're not going to speak a whole lot on this because neither of us do this every day and it's more specialty realm, is that allergen immunotherapy, whether that be an allergy shot or an oral medication, could be an option. But in my experience, that is pretty much limited to an allergy specialist, which if your symptoms are really bad and aren't managed by anything we've previously talked about, perhaps you need to think about it. And that's pretty much where we'll limit our conversation to today, so we don't speak too far outside of the scope of what we're more familiar with. So in conclusion, for this week's episode of Your Checkup, we just really want to reiterate that allergic rhinitis is very common, but hopefully with today's tools, you can recognize that it might be a little bit manageable, right? Like there's no magic bullet, perhaps, that's going to make you feel all the way better, but maybe we've come across some things that might help. We should identify triggers and reduce the exposure to those. We talked about different medication options and made you all aware that there are allergy specialists out there and maybe immunotherapies that could be helpful if none of the stuff that you listened to earlier has been helping you. And moreover, we want to thank you for coming back to another episode of Your Checkup. Hopefully, you were able to learn something for yourself, a loved one, or
an allergic neighbor.
Please check out our website, find us on Instagram, send us an email, yourcheckuppod@gmail.com. And most importantly, stay healthy, my friends. Until next time, I'm Ed Dulesky.
I'm Nicole Rufo.
Thank you and goodbye.
Bye.
This information may provide a brief overview of diagnosis, treatment, and medications. It's not exhaustive and is a tool to help you understand potential options about your health. It doesn't cover all details about conditions, treatments, or medications for a specific person. This is not medical advice or an attempt to substitute medical advice. You should contact a healthcare provider for personalized guidance based on your unique circumstances. We explicitly disclaim any liability relating to the information given or its use. This content doesn't endorse any treatments or medications for a specific patient. Always talk to your healthcare provider for a complete information tailored to you. In short, I'm not your doctor.
I am not your nurse.
And make sure you go get your own checkup with your own personal doctor.